Today, Karazanashvili Robotic Center is a leader in the treatment of prostate diseases, not only in Georgia, the Caucasus, and the Black Sea region, but also on a global level. The reason for this is the robotic technologies, the ultra-modern therapeutic and diagnostic tools we possess, our unique capabilities, and of course, the qualifications of our doctors. Our clinic offers 2 robotic technologies for the treatment of prostate tumors. Taken together, these are robotic surgery and robotic focal therapy. This combination exists in only a very small number of clinics worldwide. And I am not speaking only about Georgia, or for example, the Caucasus region. Worldwide, there are very few clinics where all of this is available at the same time. We also provide ultra-modern prostate diagnostics, which allows us to diagnose prostate tumor diseases in nearly 100% of cases. This involves transperineal fusion biopsy based on micro-ultrasound at 29 MHz. All of this is available at Karazanashvili Robotic Center, not only in Tbilisi, but also in branches such as Batumi, Kutaisi, Zugdidi, and the Vache Saburtalo branch. These technologies have been implemented for several years, and the clinic has already served thousands of patients in this field. Today, we will try to show you all these robotic technologies within a single day and how we use them in practice. At this moment, the patient is ready for robotic surgery. A robotic operation on the prostate is about to be performed. We perform robotic prostate surgery both for malignant and benign prostate diseases. In malignant cases, the prostate is completely removed. In benign cases, the tumor or adenoma is removed while the prostate itself remains intact. The techniques that we have introduced, applied, and developed on the basis of hundreds of already performed operations allow us to carry out these procedures with a minimal risk of complications. The risk of urinary incontinence, which usually accompanies such operations, is almost zero. In nearly 100% of cases, in the post-operative period, especially with the latest technologies we have implemented, patients retain urinary control. It is also possible to fully preserve male sexual function. Thus, prostate operations performed robotically, whether for malignant or benign conditions, have today become routine and highly standardized. Hospitalization requires only a few days, and the recovery period is very rapid. In our clinic, hundreds of such robotic operations have already been performed, and they have shown very good results. Today, in this operating room, we will also perform robotic focal therapy, which is a completely different type of intervention in terms of its nature, and we will show this later as well. As mentioned earlier this morning, the first method is robotic surgery. We can see the robot itself. The robotic surgical system is equipped with arms controlled by the surgeon. These arms are introduced into the human body, and the operation is performed there. This is robotic surgery. There is also robotic focal therapy. This is it. Robotic focal therapy is not surgical treatment in the traditional sense and is not invasive surgery. We do not make any incisions. Entry into the body is achieved through a special applicator, which is placed in the rectum in close proximity to the prostate. Visualization of the prostate is performed, and we destroy precisely those areas in the prostate that contain the tumor. So what is the difference between these 2 robots? The first robot, Tumai, allows us to surgically remove the prostate completely so that the patient experiences no discomfort, has no urinary incontinence. We preserve the nerves, preserve erection and potency, and eliminate the tumor. The robot focal one, on the other hand, is specially designed to treat prostate tumors without surgery. It allows us to preserve the prostate and destroy the tumor without any surgical intervention. In Eastern Europe, Turkey, the Caucasus, Central Asia, there is almost no clinic where 2 robots for the treatment of prostate diseases are available together. We did not introduce these technologies yesterday. Both robotic surgery and robotic focal therapy have been in use for several years. Hundreds of patients have recovered using these methods. I hope that many more patients and many men, both in Georgia and throughout the Caucasus region and the Black Sea region, will take advantage of these unique technological capabilities and the professionalism of our team in order to overcome prostate tumor diseases, both malignant and benign.